Today, I want to talk to you about the must-have nine, well, plus labs that you really should get if you're eating a plant-based diet. And I mean anybody eating a plant-based diet. And why should you listen to me? Well, my name is Dr. Lori Marbus. I'm a board-certified family and lifestyle medicine physician who's been plant-based herself for 13 plus years. And I've seen thousands of plant-based patients because I'm licensed in every single state in this country and DC. I've actually seen a plant-based patient in every single state. So that's pretty fun to be able to say. And over the course of that 13 plus years of seeing folks who eat a plant-based diet, I've noticed a few trends. Not everybody, majority people do great, but I do want to highlight a few things that will prevent you from feeling like the plant-based diet isn't sufficient to meet your needs, especially if you're living in this crazy world where, you're getting plant-based, vegan mock foods that are not nutritious. People are busy, they travel, they don't have time to eat as well as we should. So I want to highlight these things, why the labs are important, how to correct them, and then potentially understand some of the symptoms that you may be seeing on a whole food plant-based diet. And remember, I still believe a whole food plant-based diet is a way to go, but I'm always highlighting how you can thrive on it versus, just kind of guessing, am I doing the right things? Am I getting enough of this? So that's why I'm here. I hope you find this helpful. And by the way, everything I'm talking about is in our new book, Plant-Based 101 on Amazon, link below. Just a quick shout out. All right, so let me get to my notes. All righty. So first of all, folks who transfer, transition to a plant-based diet absolutely see benefits to their health, right? We see people lowering cholesterol, reducing the risk of chronic diseases, reversing type 2 diabetes, losing significant amount of weight. And definitely these benefits are well documented. I have patients who have lost over 300 pounds. I've had patients reverse type 2 diabetes within weeks. These are not unheard of things, but there is some potential for silent nutrient deficiencies that might go often overlooked. And so I want to highlight some of those subtle things that we need to pay attention to. And on occasion, you might be surprised what happens. If you're not used to someone who's eating a whole food plant-based diet, your regular doctor may not know what to look for. So this is the labs you can ask for them to run for you. Okay, first off, I think you'll probably guess, is the B12 and homocysteine. And you could throw in methylmalonic acid as well. So B12 is made by bacteria, guys. It's not made by animals and it's not made by plants. They live in water, they live in soil. Now, granted, when you eat animal flesh, there is some B12 stored in the flesh of the animal. So that would be probably sufficient, and because you only need a small amounts. But I'll take that back. Even a lot of my omnivorous patients that I had previous to going plant-based were often deficient in B12. That's because of really common medications, such as things for heartburn, diabetes like metformin. There are medications that decrease absorption. Plus, as we get older, we actually decrease a certain amount of a couple of things. One is hydrochloric acid and or intrinsic factor. As you get older, they break down the B12 for allow you to absorb it. So there may be decreased absorption from that. So what should you do here? Number one is take a B12 supplement. It is the one supplement that I say is non-negotiable for my plant-based patients. How much should you be taking? Anywhere between 500 to 1,000 micrograms daily. What should your lab show? I would say above 500, below 1,100. You want to be in that sweet spot, because I'm finding that even non-plant-based folks, but if you're less than 500, even in that low normal range, you may have signs and symptoms of low B12. Where you ask, well, what are those signs and symptoms? Well, let me tell you. There's fatigue. You could have some neurological issues like tingling or weakness, and you might actually see anemia. The anemia that you see, because there's different types of anemia, would be that what we call MCV, when you do what we call a CBC or a complete blood count, is large, right? You'll see the red blood cells are large. That is called a macrocytic type of anemia, which could correlate with B12 deficiency. So the one thing, if you walk away from this video, that I wanted to highlight in the beginning is please take your B12 supplement. Do not rely on fortified foods, and I don't care if other doctors have told you otherwise. I'm telling you, please take your B12. I don't know how many times I've seen people like, well, I take it on occasion. Oh, I've been plant-based for 3 years, and then they come in with these symptoms and they wonder why. Guys, please, just take your B12 supplement. there you go. Message for the day. But let's keep going. Next was, why would I check homocysteine? And why would I check methylmalonic acid? So I'm going to have two caveats here. Homocysteine, one, in and of itself, when it's elevated, can put you at an increased risk of stroke. So you want that level to be less than 10. Now, there's a few things that will drive down homocysteine, including B12, folate, and B6. Now, typically folate shouldn't be an issue on a whole food plant-based diet, but again, sometimes you're not absorbing as well. Might be worth checking if you find that your B12 level is normal in that 500 to 1100 range and your homocysteine remains elevated. You might want to have your B6 and folate level checked. In addition, somewhere down the line, choline actually might be very beneficial, like phosphatidylcholine, which doesn't increase your TMAO levels. Go look that up if you want to. When women hit menopause, we decrease our conversion of the active choline. So again, that's really important because when you're deficient in your choline, it increases risk for fatty liver and also get some nerve issues there. So there's that piece. So homocysteine, I've absolutely seen elevated in more than a few patients, made some adjustments, made things better, decreasing that risk of, elevated homocysteine and the subsequent potential higher risk of stroke. Now, do you need to check a methylmalonic acid? Now, this is just my own opinion. You can take it for what it's worth, but I'm just sharing you from my experience. One, I checked a methylmalonic acid on every single patient. Every time I order homocysteine, I'm ordering a methylmalonic acid. I've never seen it elevated, even in B12 deficient patients. So if you're looking to save money on your labs, is that absolutely necessary? I would say no. But again, take it for what it's worth. That's just my own experience. If you want to make sure that everything's in check, go ahead and check it. Just as long as it's in that normal range, you're good to go. All right. So there's that. Number 2 is iron and ferritin. All right. So why is iron important? Well, iron supports oxygen transport in the blood, right? So sometimes some people may have struggles with absorption of the non-heme iron from plant sources. Again, and especially, I've seen it more of an issue in my women who are still having periods every month, especially if they're heavy. And especially if they're hitting into that perimenopause, they might get even heavier periods. But you might notice fatigue, weakness, pale skin. You might notice hair loss, restless leg syndrome. And so what does all this mean? Well, first of all, when you check a few other things, when you're checking your iron levels, you can do an iron, what we call iron panel. So that would be a serum iron and what we call a total iron binding capacity. And that just measures your active iron that's in the blood and available, kind of the binding capacity of what's available. Like if you have a hotel room and iron is your patient or your customer, is how many of your rooms are full. It's kind of what total iron binding capacity equates to. Ferritin is like the storage unit in the back, right? It's the stored iron levels. And you can think of that when it's low and your body is still, let's say that you're not anemic, let's say that your CBC is normal, that complete blood count, so the hemoglobin hematocrit are normal. Your iron, serum iron, and your total iron binding capacity are normal, maybe low normal, but you're still having symptoms, and you go check your ferritin and it's like 10. Well, we want it above 50, right? And so that will tell you, one, to increase your iron store rich foods. That's going to be your dark green leafy foods, your lentils, your tofu, things like that. Compare them with vitamin C. Theoretically could help with absorption. And you want to avoid like coffee and tea around those meals because they can inhibit your iron uptake. And if you're a man and you have low iron, please speak to your doctor because you got to figure out what is going on here. You might want to check a stool test, make sure there's no other sources of bleeding or other things going on, kidney health, all sorts of things could be going on here. And if you're a woman and you have heavy menstruation, again, you can speak to your physician about how to deal with that piece. If you're a little bit older and you're a woman, again, you should kind of take the same look at as with men, making sure everything's okay, that you are truly iron deficient because you're not getting either absorbing enough or taking in enough. So those are the few things I would mention here. Should you take an iron supplement? I think that's a discussion you need to have with your doctor and be under the advisement of a physician, because you can take too much iron, and if you get too much iron, that absolutely is not good either. So there's a balance here, guys. I'll leave it at that. So check those out. So serum ferritin, you could make sure you're checking a complete blood count just to screen for your anemia. Serum iron, total iron binding capacity. Moving on, omega-3 fatty acids. And there's some disagreement with some people on this. I consider this an insurance policy. So what you want to check, what we're looking for is omega-3s, right? It's particularly the EPA and DHA. These are very important for your bone health, not your bone health, your brain health, your inflammation control, and heart health. So you can absolutely get ALA, which is a short chain omega-3 that converts in the body, albeit probably inefficiently, especially if you're not taking in the long form chain, so the ALA converts to the EPA DHA, okay? When you're not taking in enough of the ALA, you may not get enough of the long form. When do I see this? One, I'll check what I would recommend is checking omega-3 index, right? You want to get your levels definitely above 5.5, probably even some research shows above 8 would be sufficient to decrease your risk of heart disease and brain health and all those things. Should you take a supplement? I recommend it. Just again, it's that insurance policy. A lot of people in the plant-based space, because they're coming from a place of chronic disease, trying to reverse it, they've taken up the super low fat whole food plant-based diet. I am not always in line with that. I think that you should be making sure you're getting some nuts and seeds every single day. There's no evidence that raw nuts and seeds in their whole form actually are harmful in any way. If anything, it's the complete opposite, that it's actually very heart healthy. If you go and look at the entirety of the studies, that is what it shows. And I'll leave you that as that. I know I'm going to get other questions. I answer them in the comments below, but that is what the evidence shows in the actual research. So there you go. Plus, when you are devoid of your diet with nuts and seeds like ground flax seeds, walnuts, chia seeds, you're not getting some of the very important minerals. We'll get down here in a minute to zinc, which comes from things like pumpkin seeds, right? So again, this is a matter of taking an approach to your diet that's optimized and well balanced. Again, this book goes into it in detail, but you really want to make sure you're getting fruits, veggies, beans, whole grains, nuts and seeds, rainbow colors every single week. Try to make sure you're doing that as much as possible. So back to the omega-3s, I will share some stories there. I had a couple of patients, I would probably say over the course of the last 13 years, and I've been a doctor for well over 20 years, but the last 13 years plant-based, I've had maybe 10 to 12 patients who transition to a whole food plant-based diet present with small joint pain, discomfort that started as they started a whole food plant-based diet. In my head, I started thinking about a few things. So what we did, we added algae omega-3s and increased their whole food plant-based healthy fats in the form of nuts and seeds, avocados, and 100% across the board improved. I will also say that when I transitioned to a whole food plant-based diet, I also kind of followed the low-fat diet mantra, and I didn't feel well. I felt depressed, which is not up to my normal, and I didn't have the energy that I felt like I should, so I did more research, and I started adding in those healthy plant fats, and I have been perfectly fine since. So just sharing that absolutely is very, very important, especially with kids. They should not be on a super low-fat diet. They should be eating, lots of nuts and seeds, avocados, all those things to help support that amazing fluffy brain growth that we want. So how much of an algae omega DHA EPA should you be taking? I would say anywhere between 250 to 350 milligrams daily will definitely shoot you above that 5.5. Next up is vitamin D. This isn't just plant-based diet, but however, you may not be consuming dairy products that are typically fortified with vitamin D, and especially if you're trying to avoid, let's say, commercial or production of plant-based milks. If let's say you're going home and you're making your own, you may not be getting that fortified vitamin D in those products. So absolutely get your vitamin D. It's important for your immune health. It's important for bone health. I've seen patients who had extreme fatigue. The only thing that was abnormal, and this was not a plant-based eater, the only thing that was abnormal was a super low vitamin D. We replenished her vitamin D status and all of her fatigue resolved. So just again, another anecdotal story that highlights the need to make sure that you're getting across the board all the nutrients that you need. Now with the vitamin D, how much should you be taking? I think the RDA is like 800 IU's daily. I recommend 2,000 to 4,000, starting out with 2,000. It is a fat soluble vitamin, so you can take too much, okay? Especially if you're on the thinner side, you definitely want to start on the lower side. You may find that as you're heavier, that you may require more vitamin D than a typical dosage would be. Now, as you lose weight, you will require less vitamin D. How much do I take? I take 2,000 IU's daily. That being said, when I was even in Florida running outside every day, no sunscreen, in sleeveless shirts and shorts, I still could not get above 30, which is where I'd want you to be. How high should you go? I would try not to go above 80, but probably 40 to 60 is the sweet spot. So again, very important for your bone health, and also helps you, again, guys, it helps you absorb the calcium, which we'll talk about here in a minute. Next is zinc. So I'm thinking about all the patients that I have seen, maybe just a handful, I've actually seen zinc low on a blood test. But it's important for immunity, skin health, and wound healing. So if you're noticing some issues in there, you might want to be really thinking about increasing those those type of foods. I love to take like 2 tablespoons of pumpkin seeds daily. Again, this is going to be a calorie dense food, just keeping that in mind if you're wanting to lose weight. But again, you can do cashews. There are fortified cereals. Also, soaking sprouting grains and legumes can improve your absorption, because the grains and legumes may have a little bit of phytates, may decrease your absorption of zinc. So most of the time you're going to be soaking legumes anyway, or you're buying the can. That's fine. That all decreases it. When you cook and soak the grains, that again will decrease it. Next up is calcium. You're not going to typically see a low calcium unless you also have a pretty low vitamin D. But again, most people, if you're paying attention, especially if you're doing the additional like tofu and soy milk and those things, they have added calcium carbonate in those, or they set them with calcium carbonate. That is actually a great way to get enough calcium. That is what I do. Again, very rarely do you see a low calcium on your blood work, but you can certainly check it. It's typically found in your metabolic panels that you're already ordering. But I just wanted to highlight to pay attention to making sure you're getting enough. A great way to do this is to get something like MyFitnessPal or Chronometer. I prefer Chronometer. It tends to be a bit more accurate. And if you're a woman, especially postmenopausal woman, you want to shoot for about 1,200 milligrams daily. And again, making sure you get enough vitamin D. Do I support any calcium supplementation? Typically not. I prefer you to get that in a supplement. Now, if you're on medications for osteoporosis, you may need to take a calcium supplement, again, under the direction of your physician. So there's that. Next is iodine. This is an interesting story. So I really started paying attention to the iodine when I would have patients who are plant-based, then salt, oil, sugar-free. The one you need to pay attention to here is salt. Not that I'm saying you should take in salt, but most countries, especially the Western countries, you have iodized salt, and that's where we get most of our iodine. When you're low in iodine, your thyroid health is at risk, right? Because the thyroid takes up the iodine and it makes a thyroid hormone. And the thing that I found here was that people transition to a whole food plant-based diet, SOS free, which is perfectly fine. But guess what? They didn't pay attention to their iodine status. So now we have someone coming in saying, I was fine, but now they're telling me my thyroid's off a little bit and then I need medication. What does that mean? I'm like, well, do you consume any iodized salts or other sources of iodine? They go, no. Well, and then we check a 24-hour urine collection, because the blood is not, it's just a snapshot. It's not telling me your iodine total status. And so you go and check a 24-hour urine iodine. Yes, that means you collect your pee for 24 hours in a jug and you turn it in. I know it sounds fun, but the iodine will be low. And guess what? We replace the iodine either in supplement form. Typically, if you're a non-pregnant human being and above, as an adult, 150 micrograms daily. If you're pregnant, you require more. Kiddos, of course, depending on their age, they may require less. So those are the things to pay attention to. Now, you can absolutely increase things like seaweed, nori, kelp, things like that in your diet. Just pay attention. You don't want to take in a lot. You don't need a ton of iodine, just a swingy little smidgen. It's 150 micrograms daily. It'll take care of the rest of it itself. Now, this one's going to throw people a little bit for a loop, but let me highlight before I tell you what this is. This is because most of my patients are middle age or older. Most of them are women, and some of them, once they transfer to or transition to a whole food plant-based diet, they might have heard, oh, I'm going to eat a pound of vegetables for breakfast, or I'm going to do this. They get very restrictive in their plant-based diet, that they're eating foods that are not rich in protein. So I'm going to say check your protein status in the serum albumin, blah, 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 and total protein. And the reason I say this is because I've seen it low in people who are so restrictive of their diet that they don't consume, or let's say they wipe out all legumes because when they transition to a whole food plant-based diet, all that fiber, especially the resistant fiber that comes in legumes and stuff, blows them up with bloating, and they feel like, oh my gosh, what's going on with my gut? Because their microbiome wasn't ready for all that fiber. So they just like, I can't eat beans. They're just like, I'm intolerant. Versus understanding you can gently move in to a plant-based diet, adding in more fiber as you go along, starting with lentils, yada, yada. There's a way to do it. Again, it's in that book. So the thing here that's important to understand is that you can absolutely get enough protein on a plant-based diet, guys. Absolutely. How much protein? Well, you need 1 gram per kilogram of ideal body weight. What's ideal body weight? Around a BMI of 22. Is that across the board perfect for everyone? No, this is just a starting point. Now, if you're more active, you're wanting to lose weight, or you're, lifting weights, which everyone should be doing some type of resistance training, you might want to push that up to 1.4 kilograms of ideal body weight. Why do I say ideal body weight versus if someone has 100 pounds lose? Because you don't want to be eating enough protein to sustain 100-pound extra over your ideal body weight. You just want to make sure you're getting enough here, and that makes it more reasonable on a whole food plant-based diet. So that is the important piece. And as we get older, it becomes even more important to decrease the risk of sarcopenia, which is muscle loss. I hope I've explained that enough. So what foods do I recommend? I'm a big fan of soy again, guys. It's going to be, the soy products, tempeh, tofu, soy milk, things like that, the whole soybean, the edamame, or other legumes and whole grains. Please, please, please don't just eat a pound of vegetables for breakfast. I need you eating a balanced meal here. And even those nuts and seeds have protein, by the way. So that's about the protein status. It's a unique case, okay? So next is magnesium. Have I seen low magnesium? I haven't really seen low magnesium. I've seen lower in the normal range, but they had symptoms of a low magnesium. And you wouldn't think it's so much a risk on a plant-based diet. Again, it just depends on if people aren't eating certain foods, typically if they're very restrictive. So you may see things like difficulty sleeping, muscle cramping, things like that. Again, it's also important for your bone health. It's important for nerve function, energy production. So again, most people are fine, but you can check in if you're on that lower end of normal and you have any of those symptoms, that might be an issue. So increase things like almonds, spinach, black beans, stuff like that. So those are the recommendations. Again, these are all highlighted in my Plant-Based 101, the ultimate guide for mastering the plant-based diet. Why did we create this book, Brittany, Judy, and I? Because between the 22 years of our experience, and especially my medical experience, we wanted to put together something here that would help the beginner or someone who's been doing the plant-based diet a long time to look through and say, wow, maybe there's some things here that I can learn. So what's in here, guys? Again, we kept the Kindle edition as cheap as we could. The print one's a little more expensive because we wanted it to be beautiful, and we didn't quite understand all the extra costs with images. We thought that probably would make sense, but the next books that we're going to be putting out, hopefully later this year, won't be quite as image heavy except for Brittany's beautiful recipes. But again, it's a beautiful book. But what are we highlighting in here? And again, we're doing this because we want you guys to thrive. You absolutely can do this on a plant-based diet, but there's nothing out here that I could find. If I'd had this when I started a plant-based diet, it would have been easy. First of all, we introduce you to what it is. What is a plant-based diet? We're talking about the basics of the plant-based diet, transitioning, nutrition and health, avoiding nutritional deficiencies. How do you start cooking, recipes, eating out, traveling? We talk about Myths and misconceptions, the economic and environmental considerations. How do you integrate this into lifestyle? What about raising children, pregnancy, older adults, managing weight, food allergies, long-term, success, dealing with social situations? We list high protein foods. We talk about the lectins, the phytates, the oxalates. We talk about kids, how to deal with naysayers. And then there's about 30 recipes in the back. It is not a typical cookbook, so it's not going to be as recipe heavy because we want to educate and we want to make this very consumable. So it's not a lot of fluff. Like, it's pretty straightforward. And because we wanted to make it simple, not scary and overwhelming, we wanted to make this an enjoy to read. So I did my best, and we've gotten some great reviews so far. I don't know if there's just because they love us, but I hope you find it helpful. And if you know anyone, I gotta put this back up here, it's my prop. If you know anyone who could be like this, please to have them check it out. Oh, now it's all crooked. There we go. One other resource we have for you is a free masterclass, and it's called basically Master the Plant-Based Diet, Lose Weight, and Reverse Chronic Disease, because that's what a plant-based diet can do. And so you can check the link below. You're going to learn a few things. The 5 top mistakes plant-based eaters make on their journey. We're going to talk about the 4-step blueprint that you can use to really master the plant-based diet, just keeping these things in mind. And then the one thing that will absolutely derail your plant-based diet if you haven't put this into mind, and it has nothing to do with the food on your plate. It has nothing to do with recipes. Yeah, guys, got to check it out. That link is below. It's also free, 90 minutes, so set aside the appropriate time. So hope you found that helpful. Again, there's a lot here. Again, plant-based diet is made for everybody. We need that fiber. We're in a fiber deficient state in this world. I hope you found this helpful. And everyone that, that I work with that will actually take in a whole food plant-based diet, give them a little direction if they're struggling. They do phenomenally well, everyone. So again, thank you for being here. I'm sending joy, love, peace, and healing your way, because boy, we need more of all of that in this world. And please pass that on. So have a great rest of your day.